Good afternoon. This is Media Center, Ukraine, Odessa. We're starting our next briefing, which is dedicated to the preparedness of Odessa region for possible outbreaks of infectious diseases caused by the terrorist attack on Kakhovska hydroelectric power plant and the flood. After that, we have several guests with us today. The first one is Anzhela Popadiuk, Deputy Director of the Regional Healthcare Department of the Odessa Military Regional Administration. Good afternoon, dear residents of Odessa and those who are present here. First of all, I would like to express condolences to the families of those killed during overnight tragedy. Unfortunately, the war is ongoing. Our enemy is cruel, and I would like to ask you to follow these area alerts to preserve your lives and lives your dear ones. As for the situation connected with the explosion at Kakhovska HPP, I'd like to say that the Department of Health closely cooperates with the Odessa Regional Center for Disease Control and Prevention of the Ministry of Health of Ukraine to monitor the situation. And I would like to calm you down. As of today, the situation is fully controlled. And in case the deterioration of the situation, there are 12 healthcare units that are ready to provide health care in emergency situation. They are fully ready, and they have the medical package according to the requirements of the National Service of Health of Ukraine. They are ready to provide services in case of outbreaks of infectious diseases. The patients are referred there. I'd like to say that over recent days, we've had several meetings with the Center for Control and Prevention of Diseases and all the healthcare institutions of the region to discuss the situation with the epidemic situation to prevent outbreak of diseases and also to discuss the route of the patients. All regional healthcare institutions are ready for possible epidemical situations. There is a clear algorithm of actions to respond to possible outbreaks of diseases, including infectious diseases. The medical professionals are experienced and they constantly undergo training in this area. The department constantly controls the stocks of medication, disinfection materials, clothes, and property, and we're in constant contact with all the healthcare institutions in the region. We work 24/7. I would also like to say that social media are not always the platform that provides reliable information. And that's why we would like to ask you to rely upon the information which is regularly published on the official social pages of the Center for Control and Prevention of the Ministry of Health of Ukraine, our department, and other relevant institutions. Please rely only upon official information sources and take care about yourself and your closed ones. Together to the victory. Thank you, Anzhela. And now I would like to give floor to Serhiy Dementev, Deputy General Director of Odessa Regional Center for Disease Control and Prevention of the Ministry of Health of Ukraine. Good afternoon. Today, the epidemic situation of infectious diseases in the region is characterized as unstable. There is a seasonal increase in the incidence of acute intestinal infections. And there are also favorable conditions for the spread of infectious diseases due to the emergency situation associated with the destruction of the Kakhovska hydroelectric power plant. With the summer period, we also expect epidemic complications from intestinal infections, which is now it can be observed on the territory of the Odessa region. It is also confirmed by analytical data. For example, last year and saw 7 registered outbreaks of intestinal infections, including 6 that were related to different restaurants and cafes, and they were seen during the summer period. Now we can register sporadic cases. There are no outbreaks in the Odesa region. We also do not register the cases of especially severe infectious, including cholera. As for acute intestinal infections, last week we saw an increase by almost 42% comparing to the previous week. And in the structure of these diseases, we can see that 65% are among children up to 17 years old. And when it comes to children, disease is 55% is among children of up to 4 or 5 years. As for analysis of the factors causing acute intestinal diseases are vegetables, fruits, unwashed, and the milk products, meat products that were bought into the mass markets, and also violation of the expiry dates and the rules for cooking of food. As for a particular situation in the Odesa region, now the center, together with the Department of Health, have issued a joint order to increase the epidemical control over the acute intestinal diseases. We monitor the situation, and we also monitor the dynamics. All patients with the intestinal diseases are examined for cholera. Last week, there were 172 patients examined, and no cholera vibrios were identified. As for the monitoring of the environment, our center carries out such activities every year. This year, we have defined 100 plant monitoring points in the whole of the Odesa region according to the order of the Ministry of Health. These points have been approved and certified. From the 6th of June to the 1st of October, during the epidemic period, we usually take water probes in these boats, including water from the sea, from lemons, from rivers, from other infectious points, to carry out testing for cholera. In addition, because of the situation at Kakhovska HPP, we introduced 6 additional points for daily sampling of seawater for cholera, microbiological and sanitary chemical indicators. These are such areas at the village of Kryzhanivka, the city of Odesa, the city of Chernomorsk, and the city of Belgorod-Dnistrovsk and Vilkovo, along the coastline of the Black Sea. And there we have now control points where we monitor on the daily basis the quality of the seawater. Moreover, there are additional 3 points where we take samples to identify possible viruses. This includes Kryzhanovka, Odesa, and Chernomorsk. As for the presence of oil products, we also take probes in the 3 recently mentioned points. This is carried out 3 times a week on Monday, Wednesday, and Friday. As for the results of lab tests, over the last week, we examined 104 samples from the external environment for cholera, including 33 samples of seawater, 22 samples of fresh water, 47 samples of sewage from infectious hospitals, 1 sample of ballast water, and 1 sample of food products. So from mussels, shrimps, and the bullheads. No cholera vibros were found. Out of 9 samples of seawater, intestinal viruses were identified for virological indicators in 3 samples: Chornomorsk, rotavirus, astrovirus, salmonella, Shevchavska village, rotavirus, and Kryzhanovka village, rotavirus. The testing were made into the virological lab of the Central Control and Prevention of Disease of the Ministry of Health. I'd like to note that the results of monitoring, which is carried out by the center, is provided to all interested structures, including the regional military administration, the Department of Healthcare, and the Service for Food Safety, and the main directorate of the State Emergency Service of Ukraine, and the Ministry of Health of Ukraine. We carry out these activities every day, 24/7, and at the moment the center is ready to continue this work. We have lab teams which are responsible for weekly and daily visits to the points to take samples. As for medical materials, with the support of the Center of Civil Health in Kyiv, our center has everything possible for biological bacteria and other types of testing to check for agents of cholera and other intestinal infections. And we will come back to these issues. And now I would like to give floor to Viktor Goydyk, infectious disease specialist, medical director of the Odesa Regional Center for Socially Significant Diseases. Viktor, the floor is yours. Dear colleagues, I would like to speak more about hostile agents of different intestinal infections. I would like to say that all intestinal infections have a lot of in common. This is their route of contamination. This is the fecal-oral route. So this means that through dirty hands, bad water, bad food, which has not been properly cooked or contaminated with various causative agents. If we take into consideration the type of causative agents for cholera, salmonella, etc., due to their nature, they are not very stable to the environment. And for example, cholera is destroyed by the direct ultraviolet radiation around 48 hours. It is not stable to acid environment. It is also killed by cooking during 1 year. If there is thermal processing of food, the cholera can be killed at once. Of course, all intestinal infections have a different incubation period. So from 2 or 3 hours to several days, like cholera, from several days to 5 days, on average 3 days. And Of course, because of our mentality, we prefer self-treatment at home, and we believe that everything will pass by. But I would like to warn you right away that if you feel weakness, if you vomit, if you feel sick, if there is diarrhea, then it is better to refer to the doctor right away. You will preserve your health and you will avoid some possible severe states. Now, I would like to say that despite the fact that the whole country now tries to settle the main issue, there is still healthcare issues which is also in the focus of everyone's attention. And our today's meeting aims at providing all necessary information to you for better understanding of the situation. And you also need to remember that our health and life is the most valuable thing that we have. Now coming back to causative agents and the intestinal infections. When it comes to cholera, there were 7 or 8 cholera pandemics. The first one was seen in 1826, 27, I don't remember for sure. And it started in India, in China. But this is not the most important thing now. The most important thing is that back then the lethal level was at 90%. So it means that almost everyone died. Now, because of the new technologies, new medication, thanks to the fact that scientists and the whole humanity works, the ways to treat cholera and other intestinal diseases have been found and improved. Out of 100 infected persons with cholera, 26% could have the mild or severe form, and 20% could face the severe states. So it's like 5% out of 100. Odesa region is always ready to all infectious diseases. Because even during peaceful times, we have faced crowds because this is a tourist destination. Not all people, they follow the hygiene rules, and every year we see the outbreaks of different diseases. Our doctors are experienced enough. The capacity and the knowledge are there to fight different infections. So we saw cholera outbreaks in the 1970s, in the 1990s. We're well aware how to fight this disease. Everything has been discussed and we're well prepared. I would like to bring your attention, and I'm not the exception here, to the necessity to follow personal hygiene rules. When it comes to visiting outdoor markets where we buy strawberry, cherry, we always like to test everything at once. And do you know what was the reason of cholera in Odessa in the 1970s? That was unwashed cucumber. So cholera could be controlled, and it depends on every one of us. We need to wash fruits and vegetables. We never wash watermelons because we believe that that we eat only the middle part of the watermelon, but we take it with our bare hands, and we need to wash it. We need to wash it with the special substances. We should also process fruits and vegetables with boiled water. We need to understand that at the moment everything depends on us, and it depends on our attitude. Clinically, if you feel weakness, and there can be different manifestation of cholera and intestinal diseases, this is weakness, sickness, vomiting, you should better refer to your doctor. The doctor will be able to properly diagnose you and will appoint the proper treatment and will also prevent the severe cases of diseases. You will be able to preserve your health and also the human and medical resources that we have now. That's why you need to control and monitor your own state. There were cholera epidemics in 1970s, 1990s, but they were not that lethal. Now the level is 1.8, 2.8% of all patients with cholera, and this is not the height. And for example, flu had the same level. COVID was at the level of 6 and then at the level of 3% of lethality. We should understand that cholera is not that dangerous. And now there is a lot of information as media, and now no even quarantine required for cholera as it used to be in the past. Everything will be open. In any case, we will follow personal hygiene rule. We will wash vegetables and fruits and berries, and so the chances is more than 50% that you will not be infected by cholera and other intestinal diseases if you wash your hands. Washing your hands is mandatory. Mask is not that important because cholera is transmitted through dirty hands. And you need to remember about this. You need to explain this to your children. Adults should remember about this as well as elderly. Everyone should follow these rules. And then we will not face any problems. At the moment, doctors and medical institutions are fully ready. And I don't see any problems now, but we are getting ready anyway, because if you are well prepared, you are well protected. And we want to protect ourselves and our children from possible consequences of such diseases. Take care. Thank you. And now I would like to give floor to Svitlana Kozinova, Municipal Hygiene Doctor at the Odesa Regional Center for Disease Control and Prevention of the Ministry of Health of Ukraine. The floor is yours. Personal hygiene is very important to preserve health of all people. I would also like to add now that the quality of fresh water, of potable water, is very important. You should use only centralized water supply sources when it comes to the city. Over last several months, our center has been taking samples to check the quality of fresh water. So we have made like 50 tests for biological indicators and around 40 for phytosanitary indicators. When you use water in your household activities, you should be attentive enough. If there are no centralized water supply networks, if you use water from wells or other sources, you should be very cautious and pay attention to the quality of water and the relevant indicators, including smell or odor, color, and other indicators, including sediments and residues. If there is unpleasant odor, and if it's of unusual color, do not use this water. This can be in rural areas, and there it is recommended to use bottled water. As for personal hygiene means, I would like to say that washing your hands is mandatory. When you go outside, when you use public transport, where go to the shops, markets, or outdoors market, if you buy something at open-air markets, you should wash it. Never use unprocessed fresh vegetables and fruits, and never give it to your children. Thank you. And now we can just give floor for the questions. If there are questions, we don't have offline questions. I have questions online from my colleagues. Dumskaya.net, Rostislav. I have several questions to you. Are there settlements in the Odesa region that use water from the Dnipro River or from the reservoirs, from the territories that saw man-made disaster? And do we have any wells in the Odesa regions that also get water from those places? I will try to answer the questions. No, the Odesa region is not connected to the sources that related to Kakhovska dam disaster. I would also like to answer your question. As for wells or drills that you've mentioned in the Odesa region, and those wells that we have in Odesa have clarified water, and we take samples of the water all the time to monitor its condition. Even those reservoirs with water, those wells that people use to water their plants near their summer cottages, the water is also supplied from the central level, and it is also tested. That's why. At the moment, there is no connection between water sources in Odesa, namely the Dniester River and the Dnipro River. These are different reservoirs. There is no danger here. Am I right in understanding that when it comes to fresh water, to potable water, the impact of the disaster at Kakhovska HPP, we cannot face anything here when it comes to fresh water? Yes, this is what we mean by our answers. You've mentioned intestinal diseases. Can you get infected when swimming in the sea, or when you just gulp seawater? Let me answer the question. This is not only related to the sea, it is now related to all water reservoirs, water basins that we have in our region. Serhiy could provide more details. There is always a threat, because we have seasonal viruses like rotaviruses, like intestinal diseases. We also can face them during the winter, but temperature also affects different flora, bacteria, and viruses. And of course, we should take care, we should be precautious. Now we have those with the spread cases that we have of people swimming in the water bases and in the sea. This is not right. There is the threat of explosive materials that were brought to the Black Sea. And river mines are not that big, and they have other mechanisms of their detonation. And there is also Escherichia coli. And if children, for example, swallow water, they can be infected with intestinal diseases. But that is the usual case. That's what we faced last year and the year before last year. Now we are not threatened by the impact of the explosion at Kakhovka Dam, but I believe that our people clever enough not to get to the water basins, to the sea, even to just to make their feet wet. So we have these such diseases every year. It is not affected by the situation at Kakhovka Dam. Let us discuss the consequences of the explosion at Kakhovka HPP dam, because rotaviruses and other diseases are seasonal, but our today's topic is what can happen this year, what we have not faced before. Could you focus on this? The last question is a very short one. Is it safe in Odessa to drink tap water? Yes, it is. Our tap water meets all hygiene standards and requirements. Every day we take samples, and so you can just use it, you can brush your teeth with it. Inter-TV channel, I have a question. We can see now significant amounts of waste on the coastline of the Black Sea. It is also related to the Kakhovska dam explosion. Is it safe to be on the seaside, just to stay on the sand? But today we see a lot of people near the that waste. Is that waste dangerous? It has been already mentioned that every person is responsible for themselves and for their family. The recreation season, the holiday season, have not been officially opened, and our beaches are officially closed now. The people now can get to the coastline, and no one can prevent people from coming there. This is individual responsibility. Is there any threat there? A person can just stay near that waste. And let me just answer this question. If your question about some infections, no, there is no danger. And but they are like clearing up of the coastline. As for other diseases, then of course it's possible. You can just work outside and you can get some scratch and you can be infected with different type of infections. When we breathe in air, we also get some agents, and there is a constant struggle within our body and our immune system. Usually, our immune system destroys those numerous antigens that we get with just fresh air. And if you look at the ray of light, of the sun, you can see a lot of small particles there. All these small particles are antigens that get in our body when we inhale air, and our body just fights them. But we cannot say that this is now directly related to the explosion at Kakhovka HPP dam. This cannot lead to some especially severe infections. I would now like to clarify the question. After the events in the Kherson region, it was told that it is dangerous to swim in the Black Sea. So can you explain us the causes of such danger? If there is the increased number of potential causative agents, are there still there in water? You say now that everything is okay now, that we used to have such diseases in the past. Why is it dangerous now to swim in the Black Sea? But it was dangerous to swim in the sea last year as well. This firstly. Secondly, the water is now desalinated, and of course a lot of dirt and contaminants and Escherichia coli were brought to the Black Sea. The water is dirty. The water is contaminated now. It is not catastrophic, but we can also see there different chemicals, different oil products, and they can cause problems now. Some people could be allergic to them. Some people can just be injured. And to ensure safety, people the decision was made that it is not recommended to swim in the Black Sea. It is not related to cholera, to typhus. We just examine the situation. We are ready to any emergency situation, but as it was mentioned by my colleague, no cholera was found. These chemicals, these toxic substances, have a negative impact on our body, and of course, this could lead to increased number of patients in hospitals, and that would be additional burden on the state in general. So it is not allowed to swim in the Black Sea. Like it is not allowed, it is not recommended to take hot objects because they can injure your hand. But now we do not have some emergency situation. Thank you. And now the last question. Perhaps this question will be to you, Serhiy. A lot had been told about cholera, and of course, this is because it could be an epidemic. And what other dangers are there? Now we know about possible anthrax cases, etc., which is caused by burial grounds, by graves of animals, etc. And now we do not have some unique epidemiological situation. So there is the increase in intestinal diseases, but it is due to summer, it is seasonal. And of course, now there is increased risk of migration of these diseases, which is not related to the explosion at Kakhovska HPP dam. So these diseases can be brought from abroad. And if I'm not mistaken, for the first quarter of this year, the World Health Organization website published information that more than 20 countries in the world reported about registered cholera cases. That's why every region, every country is could face the risk of cholera. When it comes to anthrax, there are special cases for anthrax and different types of fevers and infectious, because there is always risks of outbreaks of such infections. Since 2017, 5 cases of anthrax were registered in our region. When it comes to other infections, seasonal infections, intestinal infections, including hepatitis A. We faced the increase in 2015. And every year, there are salmonella-related outbreaks. And the restaurants, cafes, etc. And that's why our center carries out the control. This was our work, which is related to prevention of diseases and epidemics. As for the accident at Kakhovska HPP dam, the water, the mass of water which was brought to the Black Sea, it is dangerous at the chemical level because of the explosive devices there. These are the causative agents of biological pathogens, so any types of causative agents that can be found in that water. And that's why we say to avoid, to prevent possible complications, we should forbid usage of the seawater in recreation zones. People should be aware of danger, of any type of danger that is there in the Black Sea. We also monitor the situation. We take samples of this water. We take radiological probes. We just check it for parasites. But at the moment, we have not found any additional risks. We're keep in touch with Kherson and Mykolaiv regions. We monitor the situation there as well. And we also take measures on the territory of our region. That's why our main risk is related to the sea water, and it is contaminated at the moment. Thank you. That was briefing dedicated to possible outbreaks of infectious diseases because of the explosion at Kakhovska HPP dam. Thank you for your time. Hopefully, we will see you here again. The next briefing will take place in 15 minutes. It will be dedicated to preparedness of Odesa housing system to the winter. Stay tuned.